The 5 medical checkups I would never get after 60. There's a deeply important truth I feel compelled to share, something that has resonated within me for over 2 decades in the medical field, a quiet unease that has grown into a profound conviction. I understand that speaking this aloud might ruffle some feathers among my esteemed colleagues, but after countless observations of patients meticulously following every medical recommendation, every screening, every guideline that comes their way, I simply cannot remain silent any longer. I'm Dr. Michael Kent, and what I'm about to reveal is an uncomfortable reality that few in our profession are willing to admit. Sometimes, paradoxically, the most detrimental course of action for your health, particularly as you advance beyond 60 or 65 years of age, is to pursue an excessive number of medical tests. I can almost hear the immediate reactions, the questions forming in your minds. Isn't a doctor supposed to be the champion of comprehensive checkups? Isn't the very essence of modern medicine rooted in prevention, in detecting potential issues before they escalate? And to that, I would wholeheartedly agree that this is precisely the pervasive narrative we've all been conditioned to accept. The mantra is ubiquitous: catch it early, find it before it becomes an insurmountable problem. Maintain constant vigilance over every aspect of your physiological being. This message permeates health campaigns, public service announcements, and even casual conversations. However, what if I told you that this widely disseminated message often omits the most crucial chapter of the story, the intricate, often challenging, and sometimes harmful sequence of events that unfolds after something unusual is discovered? Because what those glossy commercials for health screenings consistently fail to mention is that once a finding, any finding at all, no matter how benign or clinically insignificant, surfaces in your test results, a cascade of medical interventions is almost invariably initiated, and regrettably, all too often, this cascade can inadvertently, yet profoundly, erode your overall quality of life. Therefore, my purpose today is to meticulously guide you through 4 specific medical tests that, based on my extensive experience, are frequently responsible for creating more complications than they genuinely resolve, especially for individuals navigating the complexities of life beyond the age of 60. My intention is not to engender fear or to dissuade you from seeking necessary medical care. Rather, it is to empower you with a deeper understanding of the potential repercussions and the intricate journey you might embark upon before reflexively consenting to every single test that is offered. Before we delve into the specifics of these particular tests, it is imperative that you grasp a fundamental concept that has fundamentally reshaped my approach to practicing medicine. It is a phenomenon known as the cascade effect. Once you truly comprehend its mechanics, it becomes impossible to unsee its pervasive influence. Allow me to illustrate how this often insidious process unfolds. You visit your doctor for a routine screening test, perhaps feeling perfectly healthy, living your life with vibrant energy and no discernible symptoms. The test results arrive, and they indicate something. It might be a minute spot, an ambiguous shadow, or a numerical value that deviates ever so slightly from the statistically defined normal range. Now, this something could be entirely innocuous. It might have resided within your body for 2 decades, entirely dormant and destined to remain so for another 20 years without ever posing a threat. But here lies the critical juncture. The conscientious physician, bound by a duty of care and the ever-present fear of litigation, observes this finding and now feels obligated to act. What if they don't pursue it, and it later proves to be serious? This legitimate concern propels the next step, a referral to a specialist. The specialist, equally thorough, orders further investigations, often more advanced, more invasive, and more detailed tests. These new tests might corroborate the initial finding, yet still fail to provide definitive clarity. At this point, the discussion often shifts towards more invasive procedures. a biopsy, a surgical exploration, or perhaps even significant surgery. Each successive step in this cascade, from the initial test to the potential surgery, inherently carries its own set of risks: infection, bleeding, adverse reactions to anesthesia, psychological anxiety, and the significant toll of lost time and disruption to daily life. And here's the most disheartening revelation. When you finally reach the culmination of this elaborate, often arduous medical odyssey, in a staggering 9 out of 10 cases, the conclusion is that the initial finding was entirely benign. It was never poised to cause you any harm. Yet, you have endured months of gnawing worry, subjected yourself to potentially invasive procedures, possibly experienced complications, and are ultimately in a more precarious state, both physically and emotionally, than when this entire process began. All because of a test you underwent while feeling perfectly well. This, in essence, is the cascade effect, initiated by a single test that, upon reflection, you likely never needed in the first place. Let us now address the first specific test that consistently triggers this problematic cascade: whole body scans. This category includes full-body MRIs or CT scans, often marketed with the alluring promise of providing a comprehensive head-to-toe examination to catch anything before it becomes a problem. The advertisements are compelling, suggesting an unparalleled ability to gain a complete diagnostic picture of your internal landscape. And I readily acknowledge the powerful appeal of such an offer. The intrinsic human desire for complete knowledge, for control over one's health destiny, is immensely compelling. However, the lived reality often diverges sharply from this idealized vision. Consider a scenario. You are 65 years old, feeling vibrant, active, and entirely asymptomatic. Driven by a desire for absolute reassurance, you opt for one of these scans. You lie still in the scanner for 30 minutes, and a few days later, the report lands in your hands. Within its pages, the radiologist notes a minute anomaly, perhaps a small nodule in your lung, a mere 3 millimeters in size, akin to a pencil eraser, or an innocuous cyst in your kidney, or a faint spot on your liver. The recommendation reads, follow-up imaging recommended in 3 to 6 months. How does this information fundamentally alter your sense of well-being in that precise moment? You entered the clinic feeling robust and healthy, and you emerge burdened with the knowledge that something within your body warrants continued surveillance. Your mind becomes preoccupied. Every deep breath is accompanied by a silent query about that lung nodule. Every fleeting ache or sensation in your side conjures thoughts of the kidney cyst. 3 months later, you return for the follow-up scan. The anomaly might still be present, perhaps marginally larger, or its size remains ambiguous. The radiologist, exercising caution, now advises a specialist consultation. The specialist, committed to thoroughness, recommends a biopsy. A biopsy is far from a trivial procedure. It entails sedation or anesthesia, the precise insertion of a needle into your lung, kidney, or liver, and with it, the inherent risks of infection and bleeding. Critically, extensive research demonstrates that when healthy individuals over the age of 60 undergo these comprehensive scans, an unusual finding is detected in a truly astonishing percentage of cases. I am not exaggerating when I say 90% to 95% of people. These are typically small spots, minor cysts, or faint shadows, medically termed incidentalomas, findings discovered purely by incident. The overwhelming majority of these incidental findings, the vast majority, will never manifest as a health problem. They are merely the internal wrinkles and subtle changes that accumulate within a body that has gracefully navigated 6 or 7 decades of life. Yet once identified, the medical imperative to investigate them becomes almost irresistible, and thus, the cascade begins its relentless turn. Longitudinal studies have tracked individuals who underwent these whole-body scans. The conclusive finding? These scanned individuals did not exhibit any increase in life expectancy compared to those who did not undergo the scans. They did not circumvent any diseases. What they did experience were significantly elevated rates of anxiety, depression, and a higher propensity for undergoing unnecessary medical procedures. In essence, the scans did not make them healthier. They often rendered them sicker in a profound emotional and psychological sense. So, what is the alternative? The more intelligent approach. It is crucial to understand that I am not advocating for a disregard of your health. Instead, I urge you to direct your attention towards the truly pertinent indicators. Rather than seeking an intricate, often misleading picture of your internal organs, concentrate on how your body actually functions. Can you ascend 2 flights of stairs without experiencing significant breathlessness? Can you rise from a seated position without relying on your hands for assistance? How is your overall balance? What is the quality and duration of your sleep? These functional metrics offer far more insightful and actionable information about your true health status than any static scan. For a truly beneficial health checkup, seek out a physician who is willing to dedicate substantial time to your unique circumstances. Someone who will meticulously review every medication you are currently taking, as I can almost guarantee that at least one of them might be causing more harm than benefit. A doctor who engages in a meaningful dialogue about your dietary habits, your physical activity levels, and your social connections. Because these often boring, everyday aspects of your life are, in fact, the primary determinants of your long-term health and vitality. The scan is primarily designed to uncover potential problems that may not even exist. The functional assessment, conversely, is focused on optimizing and enhancing the health you already possess. This distinction is monumental. Now let us turn our attention to the second category of tests, one that touches upon a deeply ingrained fear shared by many as they age: obtaining a brain MRI for minor age-related memory issues. Picture this common scenario. You are in your mid-70s and you occasionally find yourself struggling to recall the name of a beloved actor, or you walk into a room only to momentarily forget your original intention. These are entirely normal, ubiquitous experiences that accompany the natural process of aging. However, your children, perhaps fueled by understandable concerns about Alzheimer's disease, might gently, or not so gently, encourage you to undergo a brain scan, just to be sure. I empathize deeply with this fear. The prospect of losing one's memory, of losing oneself, is undeniably distressing. But it is essential to comprehend that a brain MRI for mild forgetfulness is almost invariably unhelpful, and frequently it can be actively detrimental. This is how it typically unfolds. You undergo the MRI, and a few days later you find yourself in your doctor's office, listening as they read the radiologist's report. The language is unsettling, filled with terms like mild cerebral atrophy, age-related changes, white matter lesions, and small vessel disease. These terms sound alarming, implying a progressive deterioration of your cognitive faculties. Yet the profound truth is that these findings are absolutely commonplace and entirely normal for someone in their 70s. They are merely descriptive labels for what every aging brain inherently looks like. It is analogous to undergoing a scan of your skin and expressing shock at the revelation of wrinkles and age spots. Naturally, a 75-year-old's skin will exhibit these characteristics. The fundamental issue lies in the medical terminology itself, which, while technically accurate, fails to convey the normalcy of these age-related changes, instead implying disease and pathology. Consequently, you are left to grapple with the terrifying notion that you have sustained brain damage, convinced that Alzheimer's is an imminent threat, even though your cognitive function is perfectly within normal parameters for your age. The most frustrating aspect of this situation is revealed by robust scientific studies. When the brains of healthy individuals over 75 are scanned, more than 90% of them exhibit findings that are routinely labeled as abnormal in a medical report. More than 90%. Yet, the vast majority of these individuals possess perfectly intact memory and cognitive abilities. The visual image simply does not align with their lived reality. I have personally witnessed individuals who are incredibly sharp, engaged in complex intellectual pursuits, managing intricate finances, and excelling at crossword puzzles, whose MRIs appear remarkably terrible. Conversely, I have seen patients in the early stages of genuine dementia whose MRI scans present as remarkably normal. The picture, regrettably, does not possess the diagnostic predictive power that we often erroneously ascribe to it. So, what is the superior approach if you are genuinely concerned about your memory? There are far more effective and less invasive methods for assessment. Simple cognitive tests administered right in the doctor's office, requiring no more than 10 minutes, can accurately evaluate your brain's performance. These involve tasks such as recalling a short list of words, drawing a clock face, or counting backward by sevens from 100, straightforward exercises that directly measure how your brain is functioning rather than simply how it appears. Should these functional tests indicate a legitimate concern, then and only then do we embark on a targeted search for underlying causes. And here is the truly encouraging news. A significant proportion of memory problems encountered in older adults are, in fact, reversible. The culprit could be a particular medication inducing cognitive fog, a deficiency in vitamin B12, untreated depression, which often masquerades as memory impairment in older individuals, undiagnosed sleep apnea depriving the brain of oxygen during the night, or even a thyroid hormone imbalance. We meticulously investigate all these potential factors first, and you would be astonished at the frequency with which addressing one of these underlying issues completely restores memory function. No MRI required. Our focus remains resolutely on function, not merely on static images. We treat the holistic person, not solely the radiological picture. Of course, if an individual is experiencing progressively worsening cognitive decline, if they are routinely becoming lost in familiar environments, or if they are no longer capable of managing their personal finances, then the situation is fundamentally different. In such cases, a comprehensive diagnostic workup, including appropriate imaging, is absolutely warranted. But for the commonplace, age-related forgetfulness, a brain MRI frequently generates more problems and anxiety than it offers genuine solutions. Moving on to the third test on my list, a recommendation that often elicits surprise due to its seemingly inherent logical foundation. Routine cardiac stress tests, particularly the practice of subjecting an individual to a treadmill test solely on the basis of having attained a certain age. Consider this prevalent scenario. You are 72 years old, preparing for a routine surgical procedure, perhaps something relatively minor like a hernia repair or a knee replacement. Hospital protocols, rigidly applied, mandate that all patients over the age of 70 undergo a cardiac stress test prior to surgery. Consequently, despite feeling perfectly well, despite being able to walk several miles in your daily life without experiencing any chest pain or undue shortness of breath, you are placed on a treadmill. I invite you to pause and reflect on this for a moment. If your everyday activities already include walking multiple miles without any cardiac symptoms, what novel or critical information is a treadmill test realistically going to provide that your daily life isn't already abundantly demonstrating? Your active daily existence is your natural stress test, and you are consistently passing it with flying colors. However, protocol is protocol. So, you dutifully comply and step onto the treadmill. This is where the problematic nature of this routine practice becomes starkly apparent. Stress tests, especially in older adults, are associated with a remarkably high rate of false positives. This means the test incorrectly indicates a problem when, in reality, no genuine cardiac issue exists. Several factors can contribute to these misleading results. Your heart rate might not elevate to the same degree it once did. Certain medications you are taking can influence the results. Or there could be a myriad of other physiological reasons entirely unrelated to a dangerous coronary blockage. But once that stress test yields an abnormal result, you are inexorably propelled onto the medical conveyor belt. The next step is typically a cardiac catheterization, an invasive procedure where a slender tube is threaded through an artery all the way to your heart. To visualize the coronary blood vessels, it carries inherent risks, and frequently, upon reaching the heart, the interventional cardiologist finds precisely what one would anticipate in the heart of a 72-year-old, some mild plaque buildup, perhaps some minor arterial narrowing, but nothing remotely indicative of an impending heart attack or a condition necessitating immediate stents or open heart surgery. Yet, you have now endured an invasive procedure. Worse still, you have been irrevocably labeled as a heart patient. You are likely prescribed a new regimen of medications, and the insidious psychological damage is already done. Perhaps you were an avid tennis player prior to this, but now you are gripped by an underlying fear of exertion, convinced that your heart is fragile. The very test intended to safeguard your health has, in fact, subtly eroded your confidence and curtailed your active lifestyle. What then is the discerning alternative? It is to profoundly listen to your own body. Your body is, unequivocally, the most reliable stress test available. If you can confidently ascend stairs, maintain a brisk walking pace, and engage in your normal activities without experiencing chest pain or excessive shortness of breath, your body is unequivocally communicating that your heart is performing adequately. These are the true symptoms to vigilantly monitor: unexplained chest discomfort during exertion, unusual and disproportionate shortness of breath, or episodes of dizziness. Should you experience any of these genuine red flags, then, by all means, seek immediate medical evaluation. In such specific circumstances, a stress test is entirely appropriate and diagnostically valuable. However, if your goal is to gain insight into your future cardiac risk, there exists a vastly superior and non-invasive tool: the coronary calcium score. This is a rapid CT scan, taking approximately 5 minutes, requiring no treadmill, no needles, and exposing you to very low levels of radiation. It precisely measures the quantity of calcium, essentially hardened cholesterol deposits, present within your coronary arteries. The result is a simple, numerical score. A score of 0 indicates a very low risk of a heart attack in the ensuing years. A higher score, conversely, signals a greater need to proactively engage in aggressive preventive measures, encompassing dietary modifications, regular exercise, and potentially medication. But here is the pivotal distinction: the calcium score quantifies your risk. It serves as an invaluable guide for targeted prevention. It does not automatically funnel you down a pathway of invasive, potentially hazardous procedures. It empowers you with essential information, allowing you to make informed, autonomous choices about your health, rather than inducing anxiety that compels you into unwarranted interventions. Resist the urge to undergo a treadmill test purely based on your chronological age. Instead, trust the profound wisdom that your body communicates to you every single day. Finally, we arrive at the 4th test on my list, and I am fully aware that this particular stance is bound to spark considerable debate and perhaps even controversy. I am referring to the practice of routine screening colonoscopies after the age of 75, specifically when previous colonoscopies have yielded normal results, and the individual possesses no specific elevated risk factors. Let me be unequivocally clear: I am by no means advocating against colonoscopies. They are, without question, an extraordinarily valuable and life-saving diagnostic and preventive tool. I wholeheartedly recommend them in accordance with current guidelines for individuals beginning at age 45 or 50. Their primary benefit lies in their capacity to prevent colorectal cancer by enabling the identification and removal of precancerous polyps before they can ever progress to malignancy. If you are in your 50s, 60s, or early 70s, and you are due for a colonoscopy, I implore you to schedule and undergo the procedure. However, the critical principle to remember is that every single medical test represents a delicate equilibrium between its potential benefits and its inherent risks. And this delicate balance undergoes a significant and often unfavorable shift as we age. The principal benefit of a screening colonoscopy is the prevention of a cancer that, if it were to develop, typically takes anywhere from 5 to 10 years to grow to a stage where it causes discernible problems. But if you are 78 or 80 years old, is that long-term benefit still proportionate to the immediate and escalating risks associated with the procedure? Because colonoscopies do carry risks, and these risks undeniably increase with advancing age. There is the often arduous bowel preparation, involving the consumption of unpleasant liquids that necessitate spending an entire night in the bathroom, which can leave an older individual severely dehydrated, weak, and disoriented. There is the sedation itself, which in older adults carries an elevated risk of confusion, memory issues, or significant respiratory complications. And then there is the most serious complication that deeply concerns physicians: perforation, a tear in the wall of the colon. As we age, the colon wall naturally thins and becomes more fragile. The risk of the colonoscope inadvertently tearing through it significantly increases, roughly doubling or even tripling after the age of 75. A colonic perforation is an acute surgical emergency, almost invariably necessitating immediate extensive surgery, which can tragically result in the placement of a permanent colostomy bag. For an 80-year-old, such a major operation can irrevocably signal the end of independent living, fundamentally altering their remaining years. Now, carefully weigh this against the perceived benefit. You are attempting to prevent a cancer that would require many years to manifest as a clinical problem. If an individual's life expectancy is realistically less than 10 years, the risk-benefit equation simply does not align favorably. You are, statistically, more likely to experience harm from the colonoscopy itself than to be saved by its preventive action. This stark reality is precisely why the majority of authoritative medical guidelines now recommend discontinuing routine screening colonoscopies somewhere between the ages of 75 and 85. Of course, this is not a one-size-fits-all directive. If you have a compelling family history of colorectal cancer, if you have a personal history of previously identified high-risk polyps, or if you suffer from inflammatory bowel disease, then the calculation is distinctly different, and continued screening might be entirely appropriate. But for the average person with no such special risk factors, continuing to undergo routine colonoscopies every 5 or 10 years into your 80s is, in all probability, doing more harm than good. So, what is the prudent course of action instead? Are you to simply disregard the health of your colon? Absolutely not. The strategy shifts from invasive population-wide screening to intelligent, personalized surveillance. First and foremost, pay meticulous attention to any new or persistent symptoms. This is paramount. If you observe enduring changes in your bowel habits, if you notice visible blood in your stool, if you experience unexplained or persistent abdominal pain, unexplained weight loss, or if you develop new anemia, these are unequivocal red flags that demand immediate investigation. At this juncture, your age becomes irrelevant. A diagnostic colonoscopy is absolutely necessary to ascertain the underlying cause. Second, harness the immense power of diet. This is a profoundly impactful and risk-free intervention. The single most effective measure you can take to safeguard your colon health is to consistently consume ample fiber-rich foods, an abundance of fruits, vegetables, legumes, beans, lentils, and whole grains. Dietary fiber serves as vital nourishment for the beneficial bacteria residing in your gut microbiome, and these healthy bacteria, in turn, produce crucial short-chain fatty acids and other substances that powerfully protect against inflammation and the development of cancer. Consciously incorporating more lentils, more broccoli, more oatmeal, and more apples into your daily diet represents a form of potent, holistic prevention that benefits your entire body with absolutely zero associated risk. The overarching message is clear. Undergo your screening colonoscopies when their benefits are overwhelmingly apparent, typically up through your early 70s. Beyond that age, for most individuals, the focus should judiciously shift towards vigilant symptom monitoring and the consistent adoption of a nutrient-dense, fiber-rich diet. So, there you have it. 4 categories of medical tests that, from my vantage point of extensive clinical experience, frequently precipitate more harm than they prevent, particularly as we age past 60. These include whole body scans that routinely uncover problems that are, in fact, entirely benign, brain MRIs for normal, age-related forgetfulness that instead instill profound, abnormal anxiety, routine cardiac stress tests that unceremoniously trigger a cascade of potentially unnecessary and invasive procedures, and colonoscopies after age 75 that, for many, pose a greater risk of complication than they offer genuine preventive benefit. Do you discern the overarching pattern here? It all revolves around the cascade effect. One seemingly innocuous test leads to another, which leads to another, culminating in a diagnostic procedure, which then carries the potential for a complication. And somewhere along this winding path, we collectively lose sight of the most fundamental question. Is this individual truly, demonstrably better off as a result of these interventions? Because what I have profoundly learned over 22 years in the trenches of medicine is this: genuine health is not simply about achieving perfect test results, which often prove to be an elusive and misleading ideal. True health is intrinsically about function. It is about retaining the capacity and freedom to engage in the activities that bring you joy and meaning. It is about actively participating in the lives of your grandchildren, embarking on invigorating walks, immersing yourself in captivating books, and living your life robustly and without undue fear, liberated from unnecessary and potentially harmful medical interference. The ultimate objective at 65 or 70 or 80 is not merely to extend one's lifespan. It is, more profoundly, to live better, with unwavering independence, with inherent dignity, and with boundless joy. And sometimes, the most courageous and effective way to safeguard these invaluable aspects of your existence is to confidently say no to a test that threatens to send you tumbling down a rabbit hole of medical intervention that you simply do not need to explore. I am not, for a moment, advocating for a wholesale avoidance of all medical care. Rather, I am passionately urging you to become an engaged, informed, and truly smart patient. Ask probing questions. When your physician recommends a test, respectfully inquire why it is being recommended. Ask what the potential implications are if the test yields an unexpected finding. Demand to understand the inherent risks associated with the procedure. Inquire if there are viable, less invasive, or more functionally oriented alternatives. And then, armed with this comprehensive understanding, make a well-considered decision that is deeply aligned with your personal values, your health goals, and what truly matters to you. You, and only you, are the ultimate steward of your health journey. It is not dictated by rigid protocols, automated computer reminders, or generalized guidelines. it is your health. And the more profoundly you comprehend the implications of what you are consenting to, the more empowered and confident you will be in making truly optimal decisions for your well-being. If this information has resonated with you, if it has prompted you to critically reevaluate your perspectives on medical testing, please do me the immense favor of sharing it with someone in your life who might similarly benefit from hearing this honest conversation. And if you desire more candid, unfiltered discussions about health and medicine, I invite you to subscribe to this channel. I am committed to continuing these vital conversations because I firmly believe they possess the power to truly transform lives. Please, share your experiences in the comments section below. Have you ever felt pressured into undergoing a medical test that, deep down, simply didn't feel right to you? I diligently read every comment, and I consistently learn invaluable lessons from your lived experiences, just as I hope you learn from mine. Thank you for watching. Please, take exceptional care of yourselves, and always remember, sometimes the single healthiest and most courageous thing you can choose to do is quite simply nothing at all. Character count, 19,173 characters.